This is lab 7 on the cat specimen. So we're just finishing up in the pelvic limb, doing some of the caudal group of muscles. Just for review, here is the cranial tibial that we did last time, and then the long digital extensor and fibularis longus right here. So those are in the cranial group of muscles. Now we're going to move to the caudal group of muscles. So we're starting with the gastrocnemius here. So this is the lateral head of gastrocnemius. It does have two heads. And so the medial head will be here, medial head of gastrocnemius. And then they come together along with the superficial digital flexor right here. And that's the common calcanean tendon. So that's running over the hock. And I tend to pull out the superficial digital flexor tendon first before I do too much, so that I can pull out that superficial digital flexor from between these two heads of the gastrocnemius, because it's really fused in there and stuck to them. So I tend to start here with the tendon and pull that out, and then I work my way up on the lateral side, just kind of using the tendon and going like this, and then you just kind of pull out the lateral head versus the superficial digital flexor, which is right here. Now in the cat, you also have the soleus to deal with, which in the dog you don't have. But in the cat, we have this soleus muscle right here that's also tying in with those gastroc and superficial digital flexor muscles here. So on the lateral side, I transect the lateral head of gastrocnemius up towards the origin. And in the cat, it tends to be fused at that point, I guess, with the superficial digital flexor here. And so oftentimes when you cut through one, you cut through them both, which is okay, because you want to cut through your superficial digital flexor anyway to get to those deep digital flexors underneath down here. So transect lateral head, reflect it. You can look for that sesamoid bone that's up here, right there, where the probe is. It's a little harder to see in the cat, but you can look for that. And then superficial digital flexor muscle here, and you can transect that. On the caudal aspect here, they want you to transect on either side, either medial or lateral, the superficial digital flexor tendon along the side of it, so that you can pull it off and see the calcaneal bursa, which is just this shiny area here underneath the tendon. So try and do that. Right, so then the soleus we pointed out here, which actually gets in the way a little bit for seeing our deep digital flexor next. So we'll do our best here. So deep digital flexor will have those same heads that it had in the dog. So you have a lateral head here. And then if I move these out of the way, I can hopefully get a view here. So lateral head here, and then medial head is right here. And then you have that popliteus muscle, kind of a little triangular shape at the most proximal aspect here. So lateral digital flexor, medial digital flexor, popliteus muscle. Now we'll flip to the medial side and try and see those tendons going through. So you had your flexor retinaculum covering the tendons here. And then you have, if you can pull them out, so this one is the medial digital flexor of the deep digital flexor, and then you have your lateral. There we go. Pull that out of there. That's the lateral head, lateral digital flexor of deep digital flexor. And if you pull them out and follow them down, you'll see that they do come together and are just the one muscle with two heads. Now in the cat, we do have a more substantial caudal tibial muscle right here. So that's the tendon of it. There is a little muscle belly if you kind of move things out of the way to see it. It's right there. So a little bit bigger than the dog, but still not very big. So caudal tibial muscle. And then we have a couple of things in the joints to point out that are a little harder to see on the cat because they're a little bit smaller. But here on the lateral side, you have your lateral collateral ligament of the stifle joint. Right there we go. So lateral collateral ligament. And I'm not sure if you can, maybe we can't appreciate the meniscus on this side, but we'll pull open the knee here. So you have patella right there. And if you just kind of cut through your quads where that patella attaches and pull it down, this is a pretty good view. I'm going to go to the other side so we can pull the knee open without me being in the way. And here we go. So here you have the menisci here. So here would be the lateral meniscus, and here would be the medial meniscus. And then you have your cruciate ligaments. So again, cranial cruciate inserts cranially on the tibia, so that will be this cruciate here. And then the caudal cruciate is actually going to insert caudally on the tibia, so that's the caudal cruciate here, going back. Then on the medial side, I'm not sure if I can get this. Where is it? There we go. I don't think I can get the probe underneath it. But medial collateral ligament of the stifle joint is right here. So running there. And then in the cat, it is a little harder to appreciate the hip joint, so you may want to look at a dog for that portion. But the hip joint is here. And if you can move muscles and things out of the way, you get a little glimpse of that ligament of the femoral head right here. And then your transverse acetabular ligament will be this white line here going across. And that should be it for Lab 7.